The first thing to do when exploring dementia is to find out what dementia really is. Dementia is actually a term that refers to a large group of neurological disorders characterized by cognitive decline, memory loss, personality and behavioral changes, and impaired reasoning. It's generally associated with aging. There are over 200 defined subtypes of dementia, but we'll focus on some of the more common forms, such as Alzheimer's disease, vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. Alzheimer's disease is by far the most common form of dementia. In Alzheimer's, neurofibrillary tangles, protein deposits, and plaques disrupt connections between neurons in the brain. The onset of Alzheimer's tends to be more insidious or gradual, with harmful protein deposits forming in the brain possibly years before symptoms appear. Vascular dementia usually has a more sudden onset, showing symptoms within 3 months of one or more strokes. In this case, cognitive decline is a result of infarction or deprivation of blood supply to an area of the brain. Dementia with Lewy bodies is characterized by the presence of specific protein deposits, known as Lewy bodies, in the cerebral cortex, midbrain, and brainstem. Frontotemporal dementia has a spectrum of its own subcategories, all of them disorders caused by degeneration in the frontal and/or temporal lobes of the brain. Closely related to, but technically not a dementia, is mild cognitive impairment. Individuals with MCI may suffer from memory loss, but shouldn't show signs of functional decline. However, merely having MCI makes it 5 to 10 times more likely for an individual to be diagnosed with dementia. All the subtypes of dementia vary in their causes, prognosis, and treatment. For this reason, it's critical to determine the most accurate differential diagnosis for each patient. Diagnosing dementia in general involves taking a thorough patient history, conducting cognitive assessments, and where appropriate, using genetic testing and neuroimaging. While the process would seem clear-cut, it can actually take a long time to rule out many forms of dementia with overlapping symptoms and manifestations. Common areas of overlap include memory loss, depression, behavioral disturbances, decline in motor function, and impaired communication. As healthcare professionals continue to learn more about the similarities and differences between the types of dementia, they stand a better chance of making earlier and more accurate differential diagnoses. The more accurate the diagnosis, the more appropriate the treatment, and ideally, the better the quality of life.
Created using Powtoon.